So I'm going to be talking about the currently presented and published studies that are examining the concept of combining concurrent immunotherapy with chemotherapy and radiation for patients with unresectable stage 3 non-small cell lung cancer, as well as reviewing the ongoing and hopefully soon to be presented phase 3 studies, which will give us a much more definitive answer about whether this approach is beneficial. We know in the stage 4 setting that immunotherapy, while it can be effective by itself, is often more effective if it's combined either with concurrent chemotherapy or with radiation. This has been pretty well described. But in the stage 3 setting, the standard of care is still chemotherapy and radiation alone. And then after people have had up to about 6 weeks to recover, if they haven't progressed, if they haven't had serious side effects, then they go on to single agent Durvalumab for up to a year. And this is based on the phase 3 Pacific study. This is now our accepted standard of care. And we know that it does improve survival and even cure rates, but only by about 10 to 15%. And so the hope is that by combining immunotherapy with the chemotherapy and radiation earlier in the course of disease, that we may have a greater effect and a greater benefit to the patients.